Okay, we are back for a more focused discussion on how all of this stuff is applied in nursing. I've been alluding to it all along, but here are those 6 principles again. We talked about principalism. This is how nursing uses principalism to make ethical decisions. So, just to recap, because it can't hurt to see it again, because you know you're going to see it again. These are testable concepts. Autonomy asserts that individuals have the right to determine their own actions and the freedom to make their own decisions. For example, people have the right to refuse treatment um, for any reason at all, unless they are in danger of hurting themselves or others. Beneficence is the doing of good. You want to leave your patients better than you found them. Non maleficence is defined as the duty to do no harm, and that puts a responsibility on us to avoid doing anything that might harm our patients. And that means preventing infection, preventing medication errors, doing any nursing action in a safe, evidence based way, and making sure that we monitor the actions of people that we delegate to, so we know no harm comes to our patients from our decisions. Justice, I'm going to cover in the next slide. The principle of justice is that equals should be treated the same and that unequals should be treated differently. Now, you may be scratching your head and saying, I don't understand that. I thought justice means everyone gets the same treatment. No, that's equality. Justice is different from equality. Um, and I'm going to show you that on the next slide. Justice means that people get what they need, not that they get exactly the same as someone else, because there are people who need more. They should be given what they need. The principle of fidelity refers to faithfulness or honoring one's commitments or promises, and this can be as small as showing up for your shift on time, or as big as, when a patient asks you to relay a message that they would like to see them before they die, that you do that. All those nurses in the pandemic that had FaceTime for their patients were honoring their promise that I won't let you die alone. Um, Veracity is defined as truthfulness. Or not lying, or not documenting fraudulent data, not documenting assessments you didn't do, not documenting ahead, not trying to alter anything. Um, that is veracity. So here's a little bit more about justice. So here's inequality. Here, the tree is tilted, and more of the apples on this side. So this guy gets more apples than this guy, right? That's inequality. They have unequal access to the apples. Equality means, all right, we're going to get you closer to the tree, but we're going to give you both the same ladder. Well, the tree is still too far for this one to reach, and there's still fewer apples. So this guy is still getting more apples than this guy. That's why justice goes beyond equality. That's why people get treated unequally in a just system, because we live in a system that gives more opportunities to some people than others. Equity means we have custom tools that identify this inequality and they address it by saying, okay, we know that the tree is bent this way, so we're going to give you a taller ladder. You can get more apples. But if you notice, there are still more apples on this side, fewer apples on this side. So it's getting better, but it's not quite right. Justice is when we fix the whole system so that everybody can access the equal number of apples. That's the difference. That's my little analogy. And justice is very important in nursing, especially in today's world where systems can be unjust. So, codes of ethics for nursing. We know that ethics can be codified. A code is another social contract through which the profession informs society the principles and rules by which it functions. And you're going to say, but that's what the social policy statement is. Yes, but the social policy is a broader social contract. A code of ethics is a specific type of social contract that informs the public, this is what nursing stands for. These are the rules that we agree to uphold. In 1893, it started out as the Nightingale Pledge. I'll show you a slide of that. Then the ANA Code of Ethics for Nurses was developed. The latest edition was 2015. It's continually updated to reflect changes in contemporary society. And then the International Council of Nurses, or ICN, also wrote a code of ethics for nurses, and it addresses things that are of interest in a global society. It's very similar to the ANA Code of Ethics, but includes a lot more about global health. Here's the Nightingale Pledge. You can say it, pause the video if you want to and put your hand over your heart. I'm not going to read it. It's there. But this was the original Code of Ethics. And probably every nurse that I've ever known who's ever graduated from a school of nursing has stated this pledge. You will too. And then we have the ANA Code of Ethics. That is what on the bookmark that I gave the morning class. I'll give it to the afternoon class when I see them next week. But it has 9 provisions, and they kind of encompass every situation that nurses find themselves in. And it starts with just the basic compassion and respect for the inherent dignity, worth, and unique attributes of every person. And we are a profession built on compassion. We understand that the people who rely on us for care may be suffering or may be experiencing a crisis. And so we meet them there and we care for them. Provision 2, we're going to go into all of these in detail. It gets progressively more complex until we get to the end, where we are articulating to the world our values, maintaining the integrity of the profession itself, and integrating social justice. So we're going to go through them one by one. ANA Code of Ethics, Provision 1, respect for others. And the statement that guides this chapter is the nurse practices with compassion. I mean, that's important. It's not just competence. We have to really want to help people, and respect for the inherent dignity, worth, and unique attributes of every person. Every person. And the key components are that all human beings are worthy of respectful care without bias or preference. This applies regardless of the person's age, socioeconomic status, race, gender, sexual orientation, political affiliation, and behaviors that influence health, or the reason they come to us for care. And I'm going to give you an example of where a nurse or a group of nurses that I knew were experiencing some dilemmas in this regard. So I had a group of students on a unit in a hospital, med-surg, and they came to post-conference with a story of, I can't believe this nurse so-and-so treated this patient this way. They were very upset. He didn't want to take his medications, and the nurses kind of didn't really listen to him that much. And he said, I'll take them, but one at a time. And he wanted to say it. And they were like, nope, down the hatch. And it was in a feeding tube. But the student nurses were really struck that the nurse that they were observing was somebody that they had known to be compassionate. So I hung around the nurse's station a little bit, kind of said, so how's so-and-so, talking about this patient. And the story evolved. He had been convicted of child sexual abuse. He had made sexually inappropriate comments, gestures to nurses. He had exposed himself to the nurses. He had covered himself in feces. But the nurse in question said she just feels really strongly that anyone who hurts kids, just why am I taking care of you? And this was a moral dilemma. Did she do her job? She did, but she did not show that respect and that dignity. And so, ethically speaking, she was in violation of the code. Are her feelings understandable? Yes. But this is why you'll always see that, especially in psych, you should examine your own feelings first and then still behave ethically. Your professional ethics have to supersede your personal ones. Okay, provision 2, commitment to the patient. The nurse's primary commitment is always to the patient, not to the employer, not to the colleagues, not to the people you delegate to, not to the physicians or the other providers. Your primary commitment is to that patient. If that patient is an individual, which is most likely the case for most bedside nurses, or if the patient is the whole family, if the patient is a group, if it's the community or if it's a whole population, depending on what level of practice you are at. So that patient comes before personal gain or personal values. Just like the example I just told you about, that patient comes first, even if your personal feelings are conflicted. It comes before other members of the healthcare team. It comes before employer interests. It comes before the patient's family or friends and what they want. So your commitment to the patient is always first in provision 2. Provision 3 is advocacy. The nurse promotes, advocates for, and protects the rights, health, and safety of the patient. Patients are vulnerable. They are trusting you. You need to not only keep them safe, but make them feel safe and supported. So you need to protect privacy and confidentiality. You need to promote a culture of safety where the practices are in line with patient-centered care, evidence-based practice, and you should report any unsafe or inappropriate practice that could harm patients. So you need to be able to advocate, and sometimes you need to actually be that patient's voice. For example, if you have a patient who is impaired in some way, they have Alzheimer's or autism or severe mental illness, you need to be their voice. You need to think, what does this person need? What honors their dignity as individuals? And sometimes you need to speak up on their behalf when they can't speak up for themselves or when they feel unable to do so. Provision 4 is accountability and responsibility for practice. So the nurse has authority, accountability, and responsibility for nursing practice, makes decisions, takes action consistent with the obligation to promote health and to provide optimal care. And this is what gives us autonomy, this accountability, that there are certain things that are in our scope of practice that we can implement. There are decisions that we get to make. How do we prioritize? Which patient do we see first? How do we respond to a patient's changing condition? We have, how do we communicate with other providers? We are accountable and responsible for our practice. So in order to do this effectively, you need to know what your scope of practice is. According to your State and Nurse Practice Act, you need to know the policies of your institution, and you need to achieve and maintain competence and always keep up with the latest, best evidence-based practice. Always be looking to develop your skills with Provision 4. Provision 5, this is an interesting one. So duty to self and others. The nurse owes the same duties to self as to others, including the responsibility to promote health and safety, preserve wholeness of character and integrity, maintain competence, and continue personal and professional growth. If you don't maintain your own health and safety, you will get sick, you will get tired, and you will burn out, and that will affect your patients. So you need to take care of yourself. You cannot pour from an empty cup. Just like when you're in an airplane and you put the oxygen mask on yourself first before you help someone else. You need to attend to your own health and well-being with a healthy diet, activity, satisfying work. If you are constantly in a position where your integrity is threatened by your employer makes you work overtime, your employer doesn't allow you to have a 30-minute break in a 12-hour shift, your employer doesn't provide the resources, the equipment, or the staffing for you to do your job safely, and it creates physical and mental distress for you, then you have a duty to yourself to try and address that. Whether you do so try to resolve it with your employer, or whether you decide to seek outside employment. Workplace violence must never be tolerated. We need to fight it on a micro level and a macro level. And that includes things like lateral violence and bullying, which we will talk about with civility. Nurses should pursue lifelong learning. This is what helps us be satisfied in our jobs. When we know how to do them really well, when we get to that expert level, when we know that our care is effective, it leads to feelings of satisfaction. And we need to achieve a work-life balance. Nurses deserve to treat yourselves the same as you treat your patients, and make sure that you get the that balance that you need. Okay, moving on, Provision 6. Contributions to healthcare environments. The nurse, through individual and collective efforts, establishes, maintains, and improves the ethical environment of the work setting and conditions of the employment that are conducive to safe, quality health care. So this is at a systems level. The first part of it is to maintain civil behavior with your colleagues, and that includes colleagues from other disciplines, and it includes your relationships with people you delegate to, techs, unit secretaries, dietary staff, housekeeping staff. You need to maintain civil behavior with everybody, security guards, um, and also contribute to staff meetings and quality improvement activities. So you'll notice the first 5 provisions really deal with basic nursing practice for every nurse, generalist nurses. As we get a little further along, this is where we see the progression from novice to expert, where people take on more advanced roles. Code of Ethics, Provision 7, Advancement of the Nursing Profession. The nurse in all roles and settings advances the profession through research and scholarly inquiry, professional standards development, and the generation of both nursing and health policy. Again, we're moving on into sort of more advanced roles. When you've been a nurse a while, the basic level, just apply your evidence-based practice. If your hospital has a policy, follow that policy. If the policy needs updating because evidence has evolved, maybe contribute to that development of policy. You might be a nurse researcher and generate new knowledge that nurses can use. You might get involved with political advocacy and fight for workplace safety, fight for safer staffing, and advancing the levels of education for all nurses is important to advancing the profession. Provision 8, promotion of community and world health. So we're moving beyond the bedside, and we're seeing that healthy communities make healthier people, and that a healthier world makes for a more peaceful, safer, healthier population across the globe. So in this one, the nurse collaborates with other health professionals and the public to protect human rights. You become something of an activist. Promote health diplomacy and reduce health disparities. Make sure that you have a justice model of distribution of healthcare and not just an equal distribution of healthcare. The nursing profession holds that healthcare is a universal right. Not everyone feels that way, particularly in this country. But nurses need to stand up for justice and equity in healthcare, not just equality, because healthy communities equal healthier people who stay in communities and live good, healthy, productive, meaningful lives, and they don't have to come to acute care. And we want to address social determinants of health that create disparities in healthcare, like poverty, like bias, racism, gender bias, and other social determinants of health. Okay, last provision of the code is the promotion of the nursing profession. And this is sort of that highest pinnacle. It's almost like a Maslow's hierarchy that's just for bedside nurses. So at this point, we are looking not only at developing our own professionalism or the care of our patients. We're not just looking at caring for ourselves. We're not just looking at advancing nursing's knowledge. Now we're looking at promoting the whole profession, uplifting the standards. So the profession of nursing collectively through its professional organizations must articulate nursing values, not enough just to have them. They need to be spelled out so the public understands them. We need to maintain the integrity of the profession, and that means holding ourselves accountable. Sometimes, unfortunately, it also means, holding others accountable. And we need to integrate principles of social justice into nursing and health policy. That is the statement that the ANA makes. So this is sort of the pinnacle of what you can accomplish in your nursing career, hopefully. You will do these things. It is a very good idea to start joining professional organizations. You will have a whole project on that because this communicates to the public who nurses are and what we stand for. We have both general professional nursing organizations like the American Nurses Association or the International Council of Nurses, but we also have specialty organizations that represent us. Because a lot of times the kind of nurse we are is internalized into our identity. But this helps empower the profession. Numbers and membership give credibility to our efforts. Groups are more effective in advocacy than individuals. Nurses need to make their voice heard. So not only joining an organization, but be that change agent. Maybe that, you're the kind of person who helps shape policy, who takes on an expanded role with research. Be a role model and mentor other nurses. Be a spokesperson to non-nurses, and try as much as you can to find some avenue to address the disparities in healthcare, and make this a just and fair world for all. The last paragraph of the ANA Code of Ethics under Provision 9 talks about us healing the world. I do believe it's possible. I also believe it's a very lofty goal. But if enough of us are, sort of supporting this code, we can do things. Now, just a note before I take a break, and make this video less long than it could be. When I do an exam, I will give you that bookmark, but I will not ask you what does Provision 9 say, because that information is fairly worthless. What I will do is I will say, a nurse is engaged in this activity. Which provision of the Code of Ethics is applicable here? And I won't just say Provision 1. I will tell you Provision 1, respect for all persons, or Provision 9, promotion of the nursing profession. And then you can refer, for my sections only, I can't speak for anyone else, you can refer to that bookmark to sort of give you that statement that guides it. But you are going to need to know enough about this code to understand what it looks like in real life. And now we are going to stop the video. We'll start again with our last segment.